Aging is a privilege, but it also brings challenges. Millions of seniors worldwide face health issues that impact independence, dignity, and joy. But here's the truth. Some of the most common health problems type 2 diabetes, dangerous falls, depression, incontinence, and frailty are not inevitable. They are preventable. Yes, preventable. And it starts today with awareness, small changes, and the courage to take control of your well-being. In this video, we'll uncover how you or someone you love can start preventing these 5 health issues right now. Stay with us, because the future of your health starts here. Let's begin with type 2 diabetes. This chronic condition affects nearly 1 in 4 seniors in the United States, according to the CDC. But perhaps more alarming, many don't even know they have it. Diabetes quietly damages the heart, kidneys, nerves, and eyes over time. But here's the empowering fact. Type 2 diabetes is often preventable. The primary risk factors include being overweight, having a sedentary lifestyle, poor dietary habits, and a family history. For older adults, muscle loss and decreased physical activity can quietly increase risk over the years. Imagine this. Margaret, age 68, spent most of her retirement watching TV, enjoying sweet snacks, and gradually noticed fatigue, frequent thirst, and blurry vision. A simple blood test revealed early-stage diabetes. But with lifestyle changes, Margaret reversed it before it progressed. So how can you take action? First, move your body daily. Walking 30 minutes, swimming, or even gentle chair exercises make a huge difference. Second, change what's on your plate. Focus on vegetables, whole grains, lean proteins, and cut back on sugary drinks and processed snacks. Third, monitor your health. Annual blood sugar checks are crucial. Catch it early, manage it proactively. According to the National Institute on Aging, seniors who adopt a healthier diet and stay active reduce their risk of diabetes by nearly 60%. Diabetes isn't a destiny. It's a wake-up call, one you can answer today. Now, let's talk about falls, one of the most dangerous threats to senior independence. The National Council on Aging reports that every 11 seconds, an older adult is treated in an emergency room for a fall. Every 19 minutes, one dies from a fall-related injury. But here's the truth that many don't realize. Most falls are preventable. Meet George, 75. He loved gardening but noticed his balance was getting worse. One evening, he tripped over a loose rug, fracturing his hip. The aftermath wasn't just physical, it was emotional. Fear of falling again left him isolated. What could have prevented George's fall? Several simple steps. Exercise focused on balance and strength. Tai Chi, resistance training, and balance exercises improve stability. Home modifications. Remove throw rugs, improve lighting, add grab bars in bathrooms, and keep walkways clear. Vision and medication checks. Poor vision doubles fall risk. Some medications cause dizziness. Footwear matters. Supportive, non-slip shoes are a must. Falls are not just accidents. They are often the result of preventable risks. And preventing them means preserving your freedom, your confidence, and your life. Depression is often called the silent epidemic among older adults. It's not simply sadness. It's a medical condition that affects mood, energy, sleep, and overall health. The CDC reports that nearly 15% of seniors experience depression, but most go untreated. Why? Because people mistake it for normal aging. It isn't. Imagine Helen, 72. Since her husband passed, she's withdrawn from friends, stopped attending her book club, and feels exhausted even after sleeping. Family notices, but dismisses it as loneliness. But it's more. Risk factors for depression in seniors include loss of loved ones, chronic pain or illness, social isolation, medication side effects. But here's the hope. Depression is treatable and often preventable. Strategies include staying socially connected, whether in person, by phone, or online, engaging in purposeful activities, volunteering, hobbies, clubs, regular physical activity, movement boosts mood, seeking professional help, therapy, medication, or counseling makes a difference. Never underestimate the power of connection and professional support, because mental health is health. Urinary incontinence is one of the most misunderstood and under-discussed health issues in aging. Nearly 50% of older women and 30% of older men experience it. Yet, many suffer in silence, avoiding social events, limiting travel, and withdrawing from life. But here's what's crucial. Incontinence isn't just part of aging. It has causes and it has solutions. Causes may include weak pelvic floor, musculus, prostate issues in men, medications like diuretics, chronic conditions like diabetes or neurological diseases. Prevention and management steps include pelvic floor exercises, often called Kegels, strengthen the muscles responsible for bladder control. Healthy weight management, excess weight increases pressure on the bladder. Avoiding bladder irritants like caffeine, alcohol, and artificial sweeteners. Discussing it openly with a healthcare provider. There are treatments, medications, and even simple devices that can help. Living with incontinence shouldn't mean living with limits. Solutions exist and dignity can be restored. Frailty isn't simply getting old. It's a diagnosable medical condition characterized by weakness, unintentional weight loss, fatigue, and slowed movement. Left unchecked, frailty leads to falls, hospitalizations, and loss of independence. But the good news? Frailty is both preventable and in many cases reversible. Let's meet Robert, 80. Once active, he noticed he struggled to carry groceries, felt exhausted by short walks, and unintentionally lost weight. A doctor diagnosed him with frailty. What changed Robert's life was a structured plan, strength training, even light weights or resistance bands twice a week. Nutrition focused on protein, eggs, fish, legumes, lean meats plus vitamin D and calcium. Balance exercises and staying mentally active. Regular medical checkups to manage chronic conditions. The result? Within months, Robert regained strength, improved balance, and restored confidence. Frailty doesn't have to steal your freedom. Action today preserves independence tomorrow. Aging is a journey, and with the right knowledge, it can be one filled with vitality, purpose, and joy. Today, we've learned that type 2 diabetes, falls, depression, incontinence, and frailty are not inevitable. With small steps starting now, you can protect your independence, your dignity, and your happiness. If this video brought you insight, share it with someone you love. Together, let's empower aging with strength, with knowledge, and with heart. And don't forget to subscribe to Prevent and Live Seniors for more guidance on thriving at every stage of life.